One tiny wound, one normal infection, one pill that should save you, fails. Then the fever rises, the infection spreads, and the doctor realizes the usual answer is gone. In this video, one resistant bacteria can erase decades of medicine, turning scratches, childbirth, surgery, and cancer treatment deadly again. The first prescription is routine. Small wound, standard antibiotic. The doctor's seen this 100 times, but by morning, it's not routine. The fever's higher, the skin's worse. Something isn't responding. A stronger drug comes next, then another test. The question shifts from which antibiotic to whether any will work. This isn't one story. In 2019, drug-resistant bacteria were linked to nearly 5 million deaths worldwide. One number, 1 year. Inside the wound, the antibiotic does its job. Most bacteria die, but a few don't. The lab flags it. This isn't just slow healing. Something is surviving the drug. Those survivors multiply. And now, the infection is a different problem, one the original antibiotic can't touch. That's when it reaches the hospital. The doctors know what they're looking at, and they know the options are limited. By the time it enters the ward, the problem is bigger than one patient. Hospitals are full of people who can't fight back normally. Open wounds, tubes, fresh surgery, all of them become doors. The doctors still move fast, but now every choice is narrower than the last. And this is where it gets bigger. The next thing at risk is modern medicine itself. Before a surgeon makes the first cut, antibiotics are already working. They're not the treatment. They're what makes the treatment possible. The same is true for childbirth, a C-section, a complicated delivery. Infection risk is always there, and antibiotics keep it manageable. Cancer treatment is more exposed. Chemotherapy suppresses the immune system. That gives any infection, resistant or not, more room to move. Transplants go further. Doctors deliberately weaken the immune system to prevent rejection. A resistant infection in that window isn't just a complication, it's a direct threat. Antibiotics don't just treat infections, they're what holds the rest of modern medicine together. Outside the hospital, the pressure keeps building. Every unnecessary antibiotic gives bacteria another chance to adapt. The same pressure runs through food systems, livestock, farms, processing facilities, transport, all connected by the same cycle. And waste doesn't stay contained. Runoff can carry resistant bacteria into water systems and soil long after the source is gone. Then people move across cities, across borders. Resistant strains move with them. No single country controls this. The data shows it's spreading across regions, and the numbers keep climbing. In 2023, WHO found 1 in 6 confirmed bacterial infections resisted antibiotic treatment. And it isn't standing still. From 2018 to 2023, resistance rose across more than 40% of monitored combinations. Some regions feel it harder. More pressure, fewer tools, and less time before the next patient arrives. So the next question is worse. If resistance keeps rising, where are the new drugs? So where are the new drugs? Scientists are still searching, but this race is slower than people think. Most candidates fail. What looks promising in the lab often dies before it becomes a real treatment. And WHO says the pipeline still isn't enough. Too few drugs, too little innovation. So doctors lean harder on the drugs that still work, and every delay puts more pressure on what's left. Which raises the real question: if bacteria keep adapting faster than medicine can respond, what does that future actually look like? It starts small. A kitchen cut, the kind that should have meant nothing. Days later, it's infected. The clinic still has antibiotics, they're just less reliable than they used to be. So routine care starts changing. Extractions get riskier, minor procedures get delayed. Every small cut feels bigger. For fragile patients, delay isn't caution, it's risk. In cancer care, lost time can change everything. This is what doctors are really worried about. Not one disaster, ordinary problems becoming dangerous again. And that's the direction we're moving. By 2050, this stops being a warning. The forecast points to nearly 2 million deaths directly attributable to AMR each year. And that's only the direct count. The broader toll is larger. Millions more deaths where resistance plays a role. The burden doesn't fall evenly. Older patients, weaker bodies, health systems with less room to absorb the shock. A hospital doesn't collapse all at once. It slows. Beds fill. Procedures wait. Small infections take longer to clear. But this future isn't locked in. It depends on what changes now and what doesn't. Then the fear leaves the charts. Hospitals fill, masks come back, and ordinary infections start shaping public life again. Streets don't need to shut down completely. They just get quieter because people start avoiding the risk they can't measure. And that fear changes people. They choose distance over risk. Homes get quieter when treatment no longer feels guaranteed. This future isn't guaranteed, but it won't stop on its own. It only stops if we start treating antibiotics like a resource we can run out of. That means fewer unnecessary prescriptions, faster testing, cleaner hospitals, and new drugs that arrive before the old ones fail. Right now, that change is still possible. The drugs we have can still work longer if we stop wasting them. So the question isn't complicated. Do we protect the antibiotics we have left, or wait until the next ordinary infection shows us we waited too long?